The Rescue2-Monitor study is going to be the fifth study, randomized controlled, multi-center, to talk about home NIV in COPD. The originality of this study is going to be that it's one of the first to be with many countries in Europe, and the question of this study is going to be around the monitoring of the quality of home NIV. That's completely new. It starts with the main experts in this trial come from intensive care. And in intensive care, this physician used to monitor patients with curves, with traces, with belts, etc. And these experts start to work in home ventilation and feel that it is useful also in home mechanical ventilation. And with the devices that we have nowadays, we can have curves, we can have belts, etc. in the softwares. So we think and we make the hypothesis that we can improve the quality of home ventilation following the quality of the trace, the curves, following the quality of the monitoring. That's the key point of this trial. The hypothesis of this trial is that if you monitor the patient, you can adapt the settings, and this treatment will do better than if you are a classical monitoring with just oximetry and blood gases, and that can do it better than rescue ventilation. It means that you let the ventilator to the patient and he uses it when he wants, and that this group can do better than no NIV at home. So you understand that we are going to have 4 groups randomized to choose one of these treatment. And the hypothesis will be that we are going to delay the first hospitalization. So the main endpoint will be survival without hospitalization. I think that even if the result of this randomized control study is negative, I think that it will improve the quality of home mechanical ventilation in COPD, because we are using now for years, and monitoring is very interesting because you can adapt the settings, understanding what is happening with your patient. And so even if the results are negative or we don't finish the study, or I don't know, I am pessimistic, but even if there is not an expected result, I think that we are going to much improve the quality of ventilation in this patient and in all the other patients. So for me, to start this trial in Europe with many countries and many colleagues will be just that, a very good point and very positive point. Yes, very easily. First, to find how to titrate patients and to see the first results of home mechanical ventilation in COPD, I think it's easy. It's the study for STRIC, then called Rescue1, then the first positive study from Colline in Lancet Respiratory Medicine, and then the last one, HOT-HMV from Patrick Murphy from UK in JAMA, published 2 years ago now, who explains perfectly how to set the ventilators and the results of home NIV in COPD patients. Then, if you want to read something about monitoring, we can recommend our articles of the group Somno NIV group. We published all these articles in Thorax Journal, a series from 2011 to last one last year about asynchrony. With all these papers that you can follow us also on Twitter at Somno NIV. You have here very good papers to work for home COPD ventilation.